We don't have an advisory committee for immunization practices anymore, at least one where you would describe that committee as a group of external experts that advise then the CDC. That's not true anymore. They don't have an expertise, with the exception of arguably one of them. They don't have an expertise. Rather, they are like the Secretary of Health and Human Services, who has an anti-vaccine, anti-science bias. So I think when any of us watch those meetings now, we just hold our breath, waiting to hear what dangerous information they're about to give. It used to be that the CDC was the most important public health agency in this country. They would generate the kind of data that we needed to make good decisions, good policy decisions. They would present those data to the ACIP. The ACIP would then consider that not only at those meetings, but in working group meetings that would be formed as many as 10 months before that meeting. And then you would get, I think, very good advice based on solid data. That's not true anymore. I mean, you have people like Tom Frieden or Rochelle Walensky, who were formerly directors of the CDC, telling you they don't trust the CDC. I mean, it's that bad. Now, fortunately, a lot of groups are standing up. Different states are standing up. I know our Commonwealth of Pennsylvania is standing up and putting out what they consider to be best medical practices, and then make sure that those best medical practices are insured. Or worst comes to worst, that you have a backup plan like a vaccine for children's program, so uninsured or underinsured children can get vaccinated. So I think that's happening, but it's happening in a fragmented way.